maybe I do just a little bit more over those wrinkles. Maybe I do just a little bit more over their upper lip, and maybe I kind of feather their nose out onto their cheek. I feather this out a little bit here. And that's something I could never do when I'm working with fractional or TRL. And that is everything. And now we're going to give him that wonderful cool cow, and he will hate me a whole lot less in a few seconds. Yeah. And I will tell you, if he says it doesn't hurt, it doesn't hurt. It really does.
Really intense one.
Yeah. And what he really is not during the treatment, is immediately afterwards. So then I give people a cool cow. I let them cool down, and I never put greasy stuff, balm, recovery balm on until after they've cooled down.
Can you show us just
Yes.
without turning the machine, how do you use the under the tongue?
Touch it. Yes, oh absolutely, yes.
Without.
So yeah, I actually brought ice.
Yeah, I saw that.
So what is what you would do with this, and have you ever seen this before? Okay. So I have two different kinds of ice shields, and they're incredibly easy, and it looks so complicated. Everybody thinks it's incredibly intense, and once they've done it, it's very easy. So these ones have stems, and these are much easier to put in. But the problem is when you're working back and forth with the roller, the stem is a little bit in the way.
Which one do you
So
prefer? The one with suction or?
I don't like these, but but for full field resurfacing, where you're not trying to bump it with the roller, and especially when somebody's starting, they're very easy. So I did bring both of mine.
So this one easier to apply?
These are much easier to put in. But these are also very easy, and as soon as you've done it a handful of times, they're so easy to work with. So these you always want to keep. You'll see I have gauze between them. I sterilize them in my own office. They're very, very highly polished. Do you need aesthetic eye drops? They really are not uncomfortable. I very often in my own office, I will lay back with a mirror and let people put them in my own eyes. I really just don't care. You put a couple drops. This stays in the refrigerator. It's very important. This never go home with the patient, because if they use these drops at home, they will dissolve their cornea. You can't use them over and over and over again. But you put a couple drops of this in and some lubricating drops. I then put a little bit of that lubricating drop under this, on this, and what you'll see is they actually have a little bit of a teardrop shape.
Okay, yeah.
Okay. And the lower eyelid's small, the upper eyelid is big. So I'm going to put this down towards the bottom of the eye shield. So I'm just going to put a drop on it, and it will actually make the suction better. So what I always do is I ask the person to look all the way down at their tootsies with their eyes as open as they can. And then I just kind of lift the upper eyelid up, and I slide this up underneath the upper eyelid. And then I ask them to look up at me, and I just tuck the bottom lip right underneath their lower eyelid.
Can you do it again, please?
Yeah. So if I was going to do this, I have this here. I have the middle part of the teardrop here, and I have this placed at the bottom, like in the bottom third of the eye shield. So I'm going to put Preparicane drops, which is all cane. You keep those in the refrigerator. 2 drops, and within 5 seconds, the eye is really not. And then I'll put some lubricating drops, just like a Cystane, anything that you would use for dry eyes and allergies. Okay.
Lubricant, as an ointment or lubricant?
You can do either. I know some people who prefer ointment. I tend to put drops in, but
just drop.
either is fine. And actually, when I put this suction cup on, I actually put a drop of suction of liquid on that, and also over the top, so everything's very lubricated. And then if I was going to do this, I could almost do it myself if I had a mirror. I would have the person look all the way down with their eye kind of open, and I just lift their eyelid up and a little away from the eye, and I just slide this up underneath the eyelid, and then I have them look up, and then I tuck the lower end of the eye shield underneath, and then I squeeze this, and it releases. So now it's it. That's the easier part. The harder part, which is still not that hard, is you exactly reverse the process.
To remove it?
So to remove it, because if you leave them in and the patient walks out, they get really freaked out. If you have some patients, if you have a patient who's anxious and they open their eyes with the shields in, they will totally freak out. And I have some patients' pictures where they have the shields in. So never leave them in when the patient leaves. So to reverse the process, instead you're going to have them look all the way up, and you're going to stick this on the bottom part, and then you're going to kind of almost like birth the bottom of the eye shield out over the lower lid, and then it just slides right out.
Okay. So you
Yeah.
start from the lower.
So this time you're going to have them look all the way up to the ceiling, and then you're just going to stick this on the bottom part of it and just kind of pull the very bottom out. Sometimes it'll take 2 or 3 tries. I've never not gotten one out, so you probably have heard of that by now. But I've never seen somebody not get an eye shield out. But it might take you 2 or 3 tries at first. As I said, these are incredibly easy
Let's
because
try with this.
yeah,
At
I
the
mean,
beginning we go
these
this.
are perfectly easy to try, and you'll definitely see with these, there's a left and a right. They come in small, medium, and large.
Yes.
Almost all women, small.
Women,
Almost
small.
all men, medium.
Ah.
Occasionally there'll be a woman with huge eyes or a guy with very small eyes.
So
So
it's
woman
small and
small,
medium. Yeah.
men medium.
Usually, yeah.
Who's getting large?
Occasionally I will have some. And the real thing is what you want is you want the majority of the eye covered. And quite honestly, this is not 100% protection. Because if somebody looks around and they open their eyes, you will still see some of the white of their eyes, some of their eye rolling around. So to me, this is one layer of protection. The eyelid is the other layer of protection. This is not a very dangerous wavelength for eyes, but I'm going to keep this shut. I'm going to roll over. I mean, I can just show you on my own. This is my husband's tip, so I'm not worried about getting germs from him. But I literally will roll right over.
So now it's not working, right?
It's not, because I'm not firing.
Okay. So what's the
So it's
sound?
making noise because it's measuring.
It's measuring.
So it's still
Okay.
firing. So it's still optically measuring that I'm moving on the skin. It
but
is
it's not
not
firing.
firing the laser.
How heavy is the?
Yeah, it's not bad. And you can change that. So you can put a weight on here if you want it to lift it up harder or lighter. So you can kind of adjust it. And then I'm trying to do a demo, so I want you to be able to see this. But honestly, what you would like is you would like the head to be hanging right over the patient's face. When I see people who have it way over here and they're like trying to do a treatment
yeah.
over here, they're working so hard when they could use the gravity and the arm of the laser. Basically, I'm just treating down. I'm treating over. I treat in the eyebrow. If it doesn't have, I will lift the lower lid up and kind of treat in here. And the most important thing is that you mark a border between the cheek and here. Because if you treat the eyelid and you treat that down to the cheek, and then you treat the cheek and you treat up onto the eyelid, and I have seen this, and then a doctor will send me a picture and there's this red stripe that's pink, and it takes an extra month to heal, and the patient's like,
Why?
what have you done?
Because they
Because
do
you've done
twice.
a double density.
Twice, double.
So now you did like a 20% density on one, 20% density, but now you've done a 40% density. So that's always the issue with
Mark the bottom.
fractional, is that if you do a fractional treatment, then you do a fractional treatment in the same place, now you have a 20% all over the face, and a 40% from one strike, and it's going to heal completely differently. So, any other questions with it?
So how often do you do the eyelid treatment?
Pretty much every treatment I do.
Okay.
So my practice at this point is very boutique. I don't take new patients. If you go to my website, you'll see there's a big banner that says I'm closed to new patients. All of my patients have been with me at least 5 years. I never measure the face because I know nobody's face has changed